You opened your eyes this morning, threw off the blanket and stood up to start your day, probably without thinking twice about it. But a study analyzing tens of thousands of heart attacks revealed that those first 60 seconds after waking carry the highest risk. The hours between 6 in the morning and noon show a 40% excess risk of acute myocardial infarction compared to other times. And the simple act of standing up too quickly can trigger a blood pressure drop that researchers have linked to stroke and heart disease. The solution takes only 30 seconds, and once you understand the mechanism, you will never ignore this transition again in your life. In this video, you will discover 5 morning moves that quietly strain your heart and brain after 60, ranked from common to shocking. You will learn the exact 30-second routine cardiologists recommend to protect yourself during the most vulnerable window of your entire day. And the last move on this list will completely change the way you think about getting out of bed, because it combines 3 risk factors. If this information helps you, please like this video, subscribe to the channel, and turn on notifications so you never miss content like this. Share this with a family member or friend over 60 who could benefit and leave a comment. Do you feel dizzy when you stand up in the morning? Your blood vessels are not rigid pipes. They are living tissue that must react instantly every time you change position in space during the day. When you lie down for 8 hours, your blood pressure adjusts to that horizontal state, and your heart slows down during the night's rest. The moment you stand up, gravity pulls blood toward your legs, and your body has only a few seconds to compensate and send blood back up. Most people believe dizziness when standing is just normal aging, but science has proven it is orthostatic hypotension, a measurable condition. Researchers discovered that this blood pressure drop is not just uncomfortable, it is a marker of higher long-term risk for stroke and heart disease. Studies following thousands of older adults found that orthostatic hypotension increases the risk of coronary heart disease and stroke significantly. And the best part is that you can protect yourself with a simple routine that takes less than 1 minute, starting the very next time you wake up. Here are the 5 morning moves that quietly strain your heart and brain after 60, and what you can do to avoid every single one of them. Morning move number 1, waking up dehydrated, the invisible blood volume problem that makes everything worse before you even stand up at all. During the night, your body loses fluid through breathing, sweating, and the natural processes that continue even while you are sound asleep tonight. By morning, your blood volume is lower, which means there is less fluid circulating through your vessels to maintain stable pressure when you move. A study published by Kaiser Permanente confirmed that dehydration is a first-line factor, worsening orthostatic hypertension in older adults every single day. When you stand up with reduced blood volume, your body has an even harder time compensating, and the pressure drop becomes steeper and more dangerous. Think of your circulatory system like a garden hose. If you reduce the water inside, the pressure at the end drops instantly when you lift it up. This is exactly what happens inside your vessels when you stand up dehydrated, and it explains why morning dizziness is so common after 60 years. The solution is surprisingly simple. Keep a glass of water on your nightstand and drink it as soon as you wake up, before you even sit up fully. You do not need a large amount at first, just 6 to 8 ounces of water to begin restoring your blood volume after the overnight fluid loss period. Choose plain water or clear liquids, and avoid anything with caffeine right away, because caffeine can increase urine output and worsen the dehydration. If you wake up during the night to use the bathroom, drink a small amount of water then too, to prevent the volume from dropping even further. Some people keep a small bottle of water within arm's reach specifically for this purpose, and it makes a measurable difference in morning stability. Within 10 to 15 minutes of drinking water, your blood volume begins to rise, and your body's ability to regulate pressure improves significantly. One common mistake people make is drinking only coffee first thing in the morning, which actually increases fluid loss through its diuretic effect. If you take morning medications, use that moment to drink a full glass of water, combining 2 important tasks into one simple protective habit. For people over 60, this small change can reduce the severity of orthostatic hypertension and lower the risk of falls caused by dizziness and fainting. Hydration is especially important if you take blood pressure medications, diuretics, or any drug that affects fluid balance in your body every single day. Talk to your doctor about your fluid intake if you have heart failure or kidney disease, because your hydration needs may be different and specific. But for most people over 60, starting the day with water before standing up is one of the easiest ways to protect your heart and brain together. Remember, your body spent 8 hours without any fluid intake, and this simple habit gives your circulation the support it needs to handle the transition. Morning move number 2, straining on the toilet immediately after waking, the Valsalva effort that spikes and drops blood pressure during the vulnerable window. When you bear down during a bowel movement, you perform what doctors call a Valsalva maneuver, holding your breath and increasing pressure inside your chest. This effort temporarily raises your blood pressure sharply but the moment you release, the pressure can drop suddenly, especially in older adults with stiff vessels. The European Society of Cardiology specifically advises rising gradually after a long time lying down and after defecation and urination to avoid this drop. The problem is that most people wake up, stand up quickly, walk to the bathroom, and immediately sit down and strain, all within a few minutes of waking. This sequence combines the orthostatic drop from standing with the Valsalva spike and drop from straining, layering two cardiovascular stresses on top of each other. Think of it like revving a car engine and then slamming the brakes. Your heart and blood vessels are forced to adjust twice in rapid succession. Studies have documented cases of syncope, fainting, and even cardiac events triggered by this exact sequence, particularly in people over 65 years old. The morning hours are already the highest risk window for heart attacks and strokes, and adding the toilet strain amplifies that risk even more significantly. If you have uncontrolled high blood pressure, heart disease, or a history of stroke, this combination is especially dangerous and should never be taken lightly. The solution is to move slowly through the entire sequence. Sit on the edge of the bed first, stand slowly, walk to the bathroom without rushing at all. Once in the bathroom, avoid straining as much as possible by ensuring your diet includes enough fiber and water to keep bowel movements soft and easy. Foods like oats, prunes, flax seeds, and plenty of vegetables help prevent constipation, which is the root cause of straining in the first place for most people. If you do need to bear down, breathe normally instead of holding your breath, and take your time rather than forcing the process to finish quickly. Some doctors recommend a small footstool to elevate your knees slightly while sitting on the toilet, which changes the angle and reduces the need to strain. If you experience dizziness, lightheadedness, or chest discomfort after using the bathroom in the morning, report it to your doctor as soon as possible. This is not a trivial symptom. It is a sign that your blood pressure regulation is struggling, and it may require medication adjustment or further evaluation. Never ignore repeated morning dizziness or fainting spells, especially if they happen right after standing up or using the bathroom in the early hours. For people on blood pressure medications, the timing of your dose can make a difference. Some doctors recommend taking medications later in the morning instead. The key is to treat the entire morning sequence as a vulnerable period and move through it with awareness, patience, and respect for your body's needs. Morning move number 3, grabbing your phone and jolting into mental stress, layering a sympathetic nervous system surge onto the natural morning rise. The moment you check your phone, your brain shifts from rest mode to alert mode, and your body releases stress hormones like cortisol and adrenaline instantly. These hormones raise your heart rate and blood pressure, which is normally fine, but after 60, your blood vessels are stiffer and less able to absorb the surge. Research shows that the early morning hours already have the highest natural cortisol levels of the entire day, a phenomenon called the cortisol awakening response. When you add the stress of emails, news, or social media on top of this natural hormonal peak, you create an unnecessary cardiovascular burden right away. Think of your nervous system like a dimmer switch. Waking up should gradually turn the light from low to medium, not flip it instantly to full brightness. But when you grab your phone and read something upsetting or demanding, you force your body into high alert before it has had time to adjust properly. Studies have documented that acute mental stress can trigger heart attacks in vulnerable individuals, especially during the morning hours when risk is already elevated. While checking your phone alone will not cause a heart attack, it contributes to the overall stress load during the most vulnerable window of your day. The solution is simple but requires discipline. Leave your phone across the room or in another room entirely, not on your nightstand within arm's reach. Instead of reaching for your phone first thing, spend the first 5 to 10 minutes of your day sitting quietly, breathing deeply, and allowing your body to wake up. You can use this time to drink your water, stretch gently, or simply sit and observe how you feel without any external stimulation or information coming in. If you use your phone as an alarm, switch to a traditional alarm clock placed across the room, so you are forced to get up slowly to turn it off. This small change removes the temptation to immediately scroll through notifications, and it gives your cardiovascular system the gentle transition it needs after 60. Once you have been awake for at least 15 to 20 minutes, have moved around slowly, and feel fully alert, then check your phone if you need to. Many people report feeling calmer and more in control of their day when they delay phone use, and the cardiovascular benefits are a powerful added bonus. If your work requires you to check messages early, set a specific time, like 7 or 8 in the morning, rather than the instant you open your eyes. The goal is not to avoid your phone forever, it is to avoid the acute stress spike during the narrow window when your body is most vulnerable to it. For people with a history of high blood pressure, anxiety, or heart disease, this habit can make a measurable difference in morning blood pressure readings. Remember, the morning hours already carry a 40% excess risk of heart attack, and you have the power to reduce unnecessary contributors to that risk. Morning move number 4. Standing and walking off instantly, giving your baroreflex no time to compensate, the classic cause of morning dizziness and falls. Your baroreflex is the body's built-in system that senses blood pressure changes and adjusts your heart rate and blood vessel tone within seconds to compensate. When you lie down all night and then stand up suddenly, gravity pulls blood toward your legs, and your baroreflex must react instantly to prevent a pressure drop. But after 60, this reflex slows down naturally due to aging, stiffer blood vessels, and changes in the nervous system that controls cardiovascular adjustments. Studies show that up to 20% of people over 65 experience orthostatic hypertension, and the prevalence increases with age and medication use. When you stand and walk off immediately, you do not give your baroreflex the few seconds it needs to catch up and restore normal blood flow to your brain. The result is dizziness, lightheadedness, blurred vision, or even fainting, which can lead to falls, fractures, and serious injuries in older adults every year. Think of your baroreflex like an old thermostat. It still works, but it takes a little longer to sense the temperature change and adjust the heat accordingly. If you change the room temperature too fast, the thermostat cannot keep up, and the same principle applies to your blood pressure regulation after 60 years. The solution is to break the transition into stages. First, roll onto your side and pause for a few seconds while still lying down in bed. Then, use your arms to push yourself up to a sitting position with your legs hanging over the edge of the bed and sit there for 30 to 60 seconds. During this sitting time, pump your ankles up and down and flex your calf muscles, which helps push blood back up from your legs toward your heart and brain. This simple movement activates the muscle pump in your calves, which is often called the second heart because of its role in returning blood against gravity. After sitting for at least 30 seconds and moving your ankles, stand up slowly and pause again for a few seconds while holding onto something stable nearby. Only after you feel steady and clear-headed should you begin walking, and if you feel dizzy at any point, sit back down immediately and wait longer. One common mistake is rushing through this process because you feel fine at first, but dizziness can hit you after a few steps when your brain runs out of oxygen. If you take blood pressure medications, diuretics, or medications for Parkinson's disease or depression, you are at higher risk for orthostatic hypertension every day. Talk to your doctor about your medication timing and dosage, because adjustments can often reduce morning dizziness without sacrificing blood pressure control overall. For people with frequent dizziness, some doctors recommend sleeping with the head of the bed raised about 30 degrees, which reduces the overnight blood pressure drop. The key is to treat standing up as a deliberate process, not a thoughtless reflex, and to give your body the time it needs to adjust safely every single morning. Morning move number 5, the climax, springing fully upright the second you wake, combining the peak risk morning window with an orthostatic drop and reduced cerebral autoregulation. This is the mistake in the title, and the most counterintuitive point, because it feels natural to simply get up and go when your alarm rings in the morning. But research analyzing tens of thousands of cases shows that the hours between 6 in the morning and noon carry a 40% excess risk of heart attacks. Stroke onset also rises in parallel, with a significant circadian increase in strokes of all types during the same 6 in the morning to noon window every single day. At the same time, your cerebral autoregulation, the brain's ability to maintain stable blood flow despite pressure changes, is reduced in the early morning hours. When you spring upright instantly, you force your body to handle 3 challenges at once: the natural morning cardiovascular surge, the orthostatic blood pressure drop, and reduced brain protection. A key question researchers have debated is whether these morning events are triggered by the increase in physical activity after waking, and the answer is partly yes. The act of getting up itself is part of the morning surge, and for people with uncontrolled high blood pressure or stiff arteries, this combination is especially dangerous. Think of it like starting a cold car engine and immediately flooring the gas pedal. The engine is not warmed up, and the sudden demand can cause damage over time. Your heart and blood vessels need a warm-up period too, especially after 60, when the systems that regulate pressure and blood flow are no longer as responsive. One large Japanese study found no significant association between total stroke risk and the morning pressure surge, which shows the relationship is complex and debated. The point is not that standing up gives you a heart attack on the spot, that is an overstatement, but rather that it adds strain during a vulnerable window. For people with existing heart disease, uncontrolled hypertension, or a history of stroke, this strain can tip the balance and trigger an event in rare cases. The solution is the 30-second routine cardiologists recommend. Roll to your side, swing your legs over the edge, push up to sitting, and wait before standing slowly. This staged transition gives your baroreflex time to adjust, allows blood to redistribute, and reduces the abrupt pressure changes that strain your heart and brain together. During the sitting phase, drink some water, take a few deep breaths, and move your ankles to activate the calf muscle pump and improve circulation instantly. If you are prone to morning dizziness or take blood pressure medication, consider sleeping with the head of your bed elevated about 30 degrees at night. This reduces the overnight blood pressure drop, so the morning rise is less dramatic, and your body does not have to work as hard to compensate when you stand. Review your medication timing with your doctor, because many drugs that lower blood pressure can worsen orthostatic hypertension if taken at the wrong time of day. The most important takeaway is this: the morning transition from lying to standing deserves respect after 60, not fear, and a 30-second pause can save your life. Here is your simple action plan. Tonight, place a glass of water on your nightstand so it is ready when you wake up in the morning tomorrow. When your alarm goes off, drink the water first while still lying down. Then roll to your side and pause for a few seconds before sitting up slowly. Sit on the edge of the bed with your legs hanging over. Pump your ankles up and down 10 times and wait for 30 to 60 seconds before standing. Stand slowly, pause again while holding something stable, and only begin walking when you feel clear-headed, steady, and completely free of dizziness or lightheadedness. If you take blood pressure medications, diuretics, or medications for heart disease, talk to your doctor about timing and whether your dose needs adjustment for morning safety. This routine is safe for most people over 60, but if you have severe heart disease, uncontrolled blood pressure, or a recent stroke, discuss any new habits with your doctor first. Imagine waking up tomorrow, sitting on the edge of your bed, feeling completely steady and clear as you stand, and starting your day with confidence and control. If this video helped you, please like it, share it with someone in your family who needs to hear this, and check the 2 recommended videos on the screen now. Take care of your heart, take care of your brain, and remember that small changes in the morning can protect you for the rest of your life. Take care of your heart, take care of your brain, and remember that small changes in the morning can protect you for the rest of your life.